Bruchma Boim to the Kenes, Harabonim of Halacha. I would first want to thank Shalom Katz from Relief. Tremendous Yashakayach for putting this Kenes together. When we're speaking with Rabbonim, inviting them for the Kenes, we said this is in conjunction together with Relief. 95% asked, what's that? And unfortunately, there's not enough Rabbonim who know what Relief does. They don't know that Relief has come to Eretz Yisrael as well. In America, whoever you speak to, the first name when somebody needs mental health referrals, emotional health referrals, Relief is number one. But in Eretz Yisrael, not enough people know about it. So Be'ez Hashem, by the end of today, I hope everybody's going to know where to send to when necessary. 8.5 years ago, when Rabbi Berkowitz spoke, I think one of the first Knossim of Halacha, he spoke about the concept how Halacha is really one big b'diavad. It's b'diavad. A person really needs to have a personal rov. A person has to know who he's asking to, who the shoyel is, has to know how to answer accordingly. And he doesn't need my haskoma, but it's 100% right. And over the years, we've implemented the concept of Aselech Rav, where each caller could choose and have their own personal rov. But unfortunately, that didn't take off too well. And the numbers keep on growing, and today we have over 10,000 callers a year, 10,000 b'diaveds. But this is a way that they ask halacha, but unfortunately there's more to it. And when they're asking, because of this, people don't know when they're answering, many times there's an underlying issue, emotional, mental, and that really has to be addressed that people don't know about. It keeps on growing, Baruch Hashem. I'm sure the Rabbonim, the big Yashakayach goes to the Rabbonim who spend the hours throughout the day and night answering all the shaylas. It's over the past few months, it's been growing by at least by 20%. It's been going over all around the world. Just last week, there was an email back and forth with somebody, a bacher, who was having issues with Inyani Kedusha. And so I said, this is something that you have to speak with your Rebbe, a Rav, that knows you personally. Where are you? Maybe we could set it up. One of the Rabbanim will be happy to speak to you. He says, I'm in LA. So it's definitely going around the world. I'm not sure how. And the address of mental and emotional health, when that is an underlying issue, has to be addressed, first of all, of how to answer, and we'll hear from Dr. Friedman how to pick up when there's more to the shayla. I'll just give a few examples. We have the caller system, everything's registered, everything's recorded. And one day I see that this number called 17 times within an hour, within 2 to 3 hours. And I'm thinking, okay, the Rabbanim are not available, they didn't get through. And I listened to every single call got answered. It was a lady in the mikveh. And obviously, the Rabbanim not necessarily knew, but she had OCD. And the same shayla came 10 times before she went to the mikveh, and the same shayla came 10 times after she went to the mikveh. So if a person knows how to pick up such a shayla and how to address and what to answer, that will definitely help. Another case was when 7:30 in the morning, somebody called the emergency line and said, do you have to do kibbud avayim b'makom sakana? Sakonas nefashos comes before kibbud avayim or not? So I said, you have to explain, what do you mean? She says, my father needs something done, and I feel it has to be done. My father says it doesn't have to be done. I hold that it's a sakana. He holds it's not a sakana. So I said, are you a nurse? You want to do an operation? You need to give him an injection? Until after half an hour, it came out, she's a 14-year-old girl who wants to go away from home for Pesach. It was during Corona. And she said, if I stay home, I'm suicidal, and I don't think I'm going to make it through Pesach. So there's many shaylas which, unfortunately, they turn it as a halacha shayla, but there's more to it. And being that many people turn to Halacha when they don't have anything else to turn to, and especially even in emotional, when there's that stigma, I don't want to turn to a therapist, I don't want to turn to somebody who's more professional. So you ask it as a halacha shayla, but there's really more to it. So we'll hear now from Rabbi Berkowitz, hadracha of how to address such shaylas. Yashakayach.
The issue is how to address such shilas. I think that there's not going to be a clear boundary between what Dr. Friedman's supposed to speak about, what I'm supposed to speak about. Maybe the Hakdama has to be, I'm sure he'll say it, but if you hear it from me, maybe you'll know he's not just pushing his profession. We are not professionally trained, and don't kid yourself. And if someone has problems, we are not the address. If anything, what we are the address of is to refer. And make sure the person gets help. But no one playing amateur psychologist or psychiatrist for that matter, because we can only do damage since we do not have the training. And experience does not take the place of training. That has to be very, very clear. Someone that needs professional help needs a professional. It should just stay there. I was given a list of sugyas that often come up when dealing with people who either they themselves have issues or they're dealing with other people who have issues. The very first one listed here is kibbud av ve'em. A parent has emotional issues. Now, just because a parent has emotional issues, that doesn't mean that there's no chiyuv of kibbud av ve'em. We have the Gemara, of a mother that was crazy, and still there was a chiyuv of kibbud. The halacha, though, is that it's Mishel Av and not Mishel Ben. And the question is, what goes into Mishel Ben? Pashas the Gemara is talking about money. Tircha is not considered Mishel Ben. Tircha is considered like Mishel Av. Every time Kibbud Av Ve'em involves some kind of level of Tircha. When is it considered Mishel Ben? So we find where to learn, whom to marry. Aside from all the other shilas involved, but it says beferish that that's also would be a case of Mishel Ben. Mishel Ben means that we're not talking about hours of tircha, but we're talking about something that's life-changing. The fact that something's uncomfortable, that's not a heter. But the fact that something is life-changing. Now, included in that is the emotional well-being of a child. The child of a narcissist. The child of a narcissist is being emotionally hurt by the parent. Any abusive parent, I know the word abuse today is used very freely. Everyone's abusive. Anyone that doesn't, today, kids are constantly coming, complaining. They blame their everything about them on their parents. My parents are abusive. What does abusive mean? I just learned all about chinuch, and my parents weren't mechanech me that way. It's very nice that we have new asogis in chinuch, but if your parent is old school, that doesn't mean that they're objectively abusive. In today's day and age, we would say that's abusive and it's dangerous. But we're not going to turn them into Rishoy. The damage to the child, though, is going to be great. It's mamish going to affect their whole future. Now, we're not quick to go tell children that they can just break their relationship with their parents altogether. Sometimes that's absolutely necessary. That has to be beles breira mamish. The child is really in danger. There are many steps before that. Even where it has to be done, under most circumstances, it could be temporary. What's really necessary is for the child to be trained to deal with the parent properly. Bekitzer, again, I don't want to play therapist over here. But the more the child is dependent on the parent's approval and support, the more the child is empowering the parent to control them, and the more damage is done. What it means is that the child has to become emotionally independent of the parent so that the parent can't hurt them by saying all kinds of narishkeit. It's not that every person that says something nasty hurts someone the way a parent could. So if the child can be trained to deal with the parent, that's the lechatchila. At times, it means that the child, mamish, at least temporarily, can have nothing to do with the parent because it's much too damaging. There are times that children have to make demands on parents. Married children, for example, where parents are interfering and doing things with the children that are not lefi ruach the parents of the children, that is. You're allowed to make conditions. A child is allowed to tell a parent, I love you, I respect you, I cannot deal with the way you speak to me, If this relationship is to continue, I just have to say, I can't handle it unless something changes. And they can make rules. This is for themselves. This is for their children. They can tell parents that. Again, it has to be done very respectfully. But if this is either harming them or parents who just have no respect for their choices and the way they're mechanech their kids. Parents want to expose their grandchildren to everything. And the children are here and they want to bring up their children in a totally different way. They're allowed to make rules. Certainly when you're dealing with parents that are manipulative, they're hurting their children and possibly even their grandchildren, you're allowed to make conditions with them. And if necessary, there has to be a temporary break. In some cases, a total one. With regard to a child going to therapy, there's no Isser in Lashon Hara. Of course, their kavanah has to be l'toeles, but they can tell everything. Perhaps this is something for the therapist. It should be Aleph Beis in when they train you as a therapist. What's with Kabbalah's Lashon Hara? True, Shmi is mutar l'toeles. There's no heter for Kabbalah. How are you allowed to believe them? How do you treat someone and tell them, but I don't believe you? Or tell yourself you don't believe them? How do you do that? The answer is very simple. You believe that they're not lying to you. You believe that what they're sharing with you is the way they are experiencing things. And that's very real. We're affected by our experiences, lav dafka by what really happens. We're affected by how we experience them. It could be that Lafia MS, it could have been experienced totally differently. When you eventually meet the parent, clean slate, you don't know what he's like. But you have to believe that the child is experiencing something traumatic, something painful. His self-confidence is systematically being taken apart. You believe him. That's what he's experiencing. He's not lying to you. He doesn't come to a therapist to lie. What does he have to gain? Wasting his money? So you believe that that's what he's experiencing. You don't believe that that's the metzias. And any good therapist knows that the par between what's going on in life and how people experience it, it's like two worlds. Rechilas was mentioned here. I don't know if that meant that the general category of Lashon Hara or Rechilas B'davka. One has to be careful not to create all kinds of fights within a family. It's very, very difficult. I cannot go ahead and give a whole list of halachas of whom you tell and how you deal with siblings, and there's a younger sibling at home that you think is in danger, and the older siblings, and then there's this one, and this one's on the parent's side, and this one's not. When things get complicated, in halacha, of course, there are rules, but the first thing you have to figure out is a situation. A good family therapist, I think, can help you in a very real way. Because we are not detectives. It is very difficult for us to figure out who's who and how it should be dealt with. Unless you mamish know the whole story, have a lot of experience. And in which case, you better be careful if you're giving heterim or advice. The second part is nida. The OCD case was brought up. Let me talk about OCD for a second here. I think it's a very important thing that Rabbanim have to be told, because Balei Halacha B'teva are a bit obsessive. Let's be honest. If you're not obsessive, you don't get to the bottom of the sugya. If you're not obsessive, you don't go in, what about this case? To say a shtickle Torah, you don't have to be obsessive. To come to Halacha L'maisa, you have to have that quality. What that means is that when you're dealing with someone who's obsessive, it could be contagious. You can start taking them seriously. Some of these people are big balei kishrin, and they ask you shilas, and they're ingenious. And you can start believing them. So I had this guy that comes to me. He's married a couple of months. He came from Chutz La'aretz. He came here, and he said his Shalom Bayis is real. They're near a get already. What's the problem? He's pretty sure he didn't have kavanah for kedushin under the chuppah. And when he watched the video, he saw that one of the Eidim wasn't watching. He doesn't really think he's married. And because of that, he feels uncomfortable with his wife. And she picked up on it, and he finally told her. And she told him, either get help or this is all over. So I told him, you better get help. Good. They put him on medication. He's better, but he's still in trouble. Then came the next parsha. There was a workman in the house, and Epis, he told his wife something, and he thinks that his wife understood that it was kinui, and Lamaisa, the workman, was in the house when he wasn't there. And certainly the way the wife understood it and said it over, it was kinui, and mele it's a shabi anavshe that she's asir to him. So my first reaction was, there's no kinui steer since you're not really married. He didn't like that. He didn't like that. Now, the idea is, I'm not a therapist, but he's got to be brought to the point where he stops taking himself seriously. Until then, it's never ending. It's mamish never ending. You have these people with Natil Sedayim, with Nadarim, everything's a suffix neder. Mikveh, a woman with OCD, a fruman with OCD. Mikveh is traumatic. Not just mikveh. I've had some different kinds of situations over the years. I'll tell you, there was a kufa that I was mamish working b'shutvis with Dr. Banchek, Zichron Levracha, who at a certain point in time that became his field. And he would send me people, and he said, listen, all I need is for you to tell them that to disregard everything. So I'll tell you. I mean, you can't say we're going to matter everything under the sun. There's a famous zog from the Stipler. The Stipler used to say, das nicht wissendig von einer, was hat Nerven, schafft nicht kein Suffix. The fact that when someone's got OCD, and he doesn't know this and he doesn't know that, it doesn't have a shame suffix. It doesn't begin. It doesn't begin. In a case of a husband that has OCD and is finding samim wherever he looks, and we've had such people, you tell him the achrayus for Hilchas Nida is your wife. If she thinks it's a shayla, she can ask it. If she doesn't think it's a shayla, you've got to trust her. You don't have the kalim to ask shaylas. It's bothering you? See a professional. That's not my job. But in terms of halacha, he cannot be the one raising the shaylas. In terms of a woman that constantly has sfeikus, did she check here and did she check there and did she clean here and did she wash there? That's not a suffix. You got to chap that she's got OCD. I hope by now you've developed something of an intuition. Either it's the volume or sometimes it's just the nervousness that comes with it, the way they express themselves. It's not a shayla. It's not a suffix. You got to be careful because it's contagious. You get chapped into it. You really think it's a shayla. Then you start looking, making cheshbonis. What is it? Forget about it. Forget about it. It's not a shayla. It's not a shayla. Maybe one time there is a shayla. You have no way of knowing. You have no way of knowing, and it doesn't start. Finished. And the odds are it's never. If there'd be a real shayla, the husband would know about it. A real shayla, you don't have to worry about it. Ki hu zeh. And you have to say it with confidence. When you're dealing with someone with OCD, if you don't give them a clear, definitive answer, they'll still have sfeikus about what you told them. Same thing with davening. The same thing with davening. So first of all, someone that it takes him 15, 20 minutes to say Shema, he needs professional help. Some go with medication, some go without medication. That's a professional decision. Really, therapy should do it, but if you don't take the edge off their anxiety, the odds are that you're not going to be able to, they just won't get anywhere. They just can't get past it. They may just need temporary medication so that they'll be able to be successful in therapy and learning what's going on in their mind and learning to not take themselves seriously. Until that point, you just tell somebody, say Shema, you have sfeikus if you said the word right or not. That's not a suffix. Understand, you are one of those people that is in the class that doesn't have, they're not sfeikus. It's nerven, it's not sfeikus. You're sure it is? It doesn't make a difference. It doesn't make a difference. If you can work with the therapist together, that makes things a lot easier. I know Dr. Banchek, I remember the first big case he decided he was going to crack. It was a kid, this little kid. The kid was an Ilui. But everyone thought he was a nut. He spent hours davening every day. It was Krishma, it was Shemon Esrei, he spent hours davening every day. Dr. Banchik made him his project. He ended up writing a paper on him. He had him daven in his office. Baruch Hashem, he was successful. He made a mensch out of it. He is such a beautiful person. An Odom Choshev. He's going through Shas B'iyun very, very well. He's an Eloi, but he's such a mensch today. He can save these people's lives. Send them for help. So this covers Shalom Bayis as well. Obviously OCD. I don't know emotional issues of Shalom Bayis has anything to do with the OCD. Let's talk about emotional issues separately. Emotional issues that are causing Shalom Bayis. Of course, you send to a professional. What's the shaila? The shaila is as far as, first of all, contraception. Talking about mania when there are Shalom Bayis problems. So first of all, you don't make such a decision without a professional being involved. A professional has to be involved. I know we had cases where there were people that were in therapy. The therapist said that they cannot conceive, they should not have another child till they work this out. And it was either the man or the woman that refused and said it's not her hashkafa. The therapist is not, you're not my Rav, you're not my Rosh Hashiva. Who is your Rav? I know what I subscribe to. There were cases I brought people, you may remember we had one. We took him to Shlomo Zalman. You remember that one? Shlomo Zalman told him, if you don't use contraception, you're a Ritzeach. You're going to create a child that's growing up in a house with terrible Shalom Bayis that will never be able to be solved because your wife is going to be pregnant all the time. So one way or another, it has to be done, but you should have a professional involved. Shalom Bayis issues, it's not automatic that they should be on contraception. L'moshel. This is a big shaila today. In America, it's mamish wholesale. They tell couples, for the first months you should be on contraception. That's the style today. Your kids, you got to see that you spend time together, that you have a honeymoon first, but you're going to go right away and you're going to get pregnant immediately. There are rabbonim that mamish give heterim for months when they first get, for everybody across the board. Now, if you're dealing with a situation where someone really suffers from anxiety, there's some problem there, okay? If a professional will say that they should not get pregnant immediately, we understand it. So let them put off the chasna. No, that's the whole thing. They have to experience it. And by the way, who says that there's a nafka mina between putting off the chasna or using contraception? It's a sugya, but who says? Who says there's such a nafka mina? At least let them be married. But the standard case, I've seen so many situations where two kids get married, and it's rough. Come on, Shana Rishayna is not easy. The only thing that got them to work was the fact that they were expecting a child. They knew this is for real. That was the only thing that got them to work. Lav dafka, that's the way to start out. You got to know whom you're dealing with. As a rule, now if the colors are coming in, all the friends got ahead. What kind of Rav do you got? The Chassan's got this one, a Fruma Rav. Lav dafka, that's the best thing. Phil Brachas, we talked about it. Not in the right frame of mind to keep mitzvahs. This is a general question. There's too much involved here, but I want to talk about an extreme case. We have to discuss where emotional health is considered pikuach nefesh. B'derech klal, you see in the tshuvas, what we today call personality disorders, and sometimes even the chemical ones, lav dafka have the din of pikuach nefesh. Rav Moshe writes, we give it halacha, a person would give kol ma'amonai that he shouldn't have such a thing. He wouldn't call it pikuach nefesh. Even a breakdown, he refused to call pikuach nefesh. When is a pikuach nefesh? Well, chas v'shalom, there's a question of a person becoming suicidal. That's klar pikuach nefesh. That is klar pikuach nefesh. A breakdown without a chash of suicide is at least chayli. Or where there's any chash of the person harming themselves, that's pikuach nefesh. Obviously, you need a professional to tell you that. It may not be a bad idea for all rabbanim to be trained in dealing with people who are suicidal, or you're on the spot and someone's I know years ago we had in Aish we had the whole staff. We had the whole staff trained on dealing with emergencies, and one of them is dealing with suicides. And mamish, within a few days, I had to deal with my first suicide case. And Baruch Hashem, I had the script. I knew exactly what to deal. Right away, you have to evaluate, where's he coming from? Is it real? Is he depressed? Is he manipulative? You have to know which one. Right away, I champed this guy's manipulative, and I told him, you're a Baal Bechira. If you choose to kill yourself, you're a Reitzeach. It will be no one else's fault. That was the end of it. He was done. He got off the roof. He's done. That doesn't work if the guy's depressed. But all I'm pointing out is that when you're trained, you don't become a professional. But at least you know how to deal with an emergency. Otherwise, what are you going to do? Davinenu, I haven't found that the police know how to deal with this. They should have training, but lav davka. They're busy. Their eager thing is that there shouldn't be they have to be able to say Yadeinu le'shavchu es adam hazeh, only that they didn't do something that caused the suicide, and if they do nothing, then they're okay. So it's not partial. You may have to make a decision on the spot. It's kedai to be trained. Someone who's suicidal, and listen, if they tell you, if I have to call my therapist on Shabbos, can I? The answer is, of course, yes. Befrat using a phone today, exactly what the yisur is. We're not dealing with Doraisis. So Rav Poiskim, we're not dealing with Doraisis on the phone. Ksiva of the phone number. At the same time, don't let people scare you when they say they're suicidal. You got to know it's true. I had one particular case of a woman that Kaseder, she wanted to eat on Yom Kippur, she's suicidal. I got the feeling from talking to her that she was not suicidal, she was manipulative. I sent her first to Dr. Banchek, and he said, this woman is not suicidal. Just to be sure, I then sent her to Dr. Quinn, psychiatrist. Sent her to Dr. Gary Quinn. Calls me up. This woman is manipulative. What's the ma'isa? It was Nizbar. Her husband's a nice guy. But she married a brisker and she wasn't ready for it. And there were all kinds of chumras that she just wouldn't go with. She then chapped that the one thing you can get away with a brisker is pikuach nefesh. So she decided she was suicidal. She made herself ganz meshuga. She decided that she was suicidal. And alze mutter. So when it got to me for eating Yom Kippur, I said no. So she said, but I can get suicidal. Told her I can't be mattered. She made it through Yom Kippur. It's been many Yom Kippurs since then. She's okay. She's been in and out of help. I don't know, she insisted on choosing her own therapists, and she seems to know whom to go to. So you have to know. There are people that have anxiety. They call every year before Yom Kippur. I don't think I can make it through the day. So for years I've been doing this, and then I found out that Reb Shlomo Zalman used to do this. I say, if at any point you feel that you're going to die, you can eat immediately. And that does it. They have a pas basali and they're all right. Rosh Hashanah used to say that. If at any point you feel like, you're going to say eat, and then they don't feel like they're going to die. But listen, you got to know who you're dealing with. You got to make sure that there's not something else going on that you don't know about. Anybody who seemingly is not a straightforward personality and there are issues here, make sure they get an evaluation. Adarabba, the fact that they've got a shiloh about fasting in Yom Kippur may be a great opportunity of getting them to a professional where they wouldn't have gone otherwise. If you tell them that the psak depends on them seeing so-and-so, they'll go. Shmir Zaloshin, when the caller has emotional issues. There are lots of different personality disorders and lots of different shilas you get in Shmir Zaloshin. You get people where the whole world is out to get them, be it that they're paranoid, be it that they're borderline. This one's out to get them, and that one's out to get them. Okay. They come, how do they deal with this? This person hurt me, this person hurt me, this person hurt me. I want to tell them, I want to tell others. I have to tell you a ma'aseh. A woman calls me up. She was being treated by a doctor, and she claims that he touched her inappropriately. Now, I happen to know this woman. I know that she's in therapy. I called up her therapist. I know her therapist. I called up her therapist. This woman is borderline. I called up the therapist and I said, listen, I did not get permission to call you. I need you to answer just one question. Could she imagine a doctor doing a regular examination as touching her improperly? Without batting an eyelash? The therapist said yes. The therapist said yes. Turns out this woman sent a letter to this doctor's wife. So I called up the wife. The wife said, I don't believe it, but if I'm getting such letters, I want him to quit his practice. Let him go back to Kyle. He's a from doctor. I told her, disregard this letter. This woman is not well. Now, there's an exception. Unfortunately, there have been lots of situations where that's not true, and then you have to find out how to deal with it, both in terms of the authorities. There's a whole different sugya. About what you tell the authorities, what you don't, and pashtus, anything that you have a chiyuv to tell about today, pashtus you do have to report. And b'derech klal, today there are more people in the authorities that you can speak to that will know how to handle it properly. B'chlal, I think this is something that Rabbanim have to know. The machzik betik harvacha in Iriyat Yerushalayim is Nani Grossboy. I'm from Kid. He grew up in Marachava. He played with my kids. If you have any situation where Lefi HaChok you have to report, speak to him. He's mamish one of us. He's einer von uns, no kums. If there's a shaila, so, a shaila has to be asked. But if it has to be reported, he will direct you. Either he will take care of it himself, which is probably the best way. If not, he'll direct you to the right person. He himself asks shailas every step of the way. So there's a whole other sugya. This is not mental health, although it is mental health. I mean, someone who's doing something he shouldn't do has a problem. But I would hope that everyone understands that certainly today you don't just be mashtik things. It's not the way to deal with it. We understand that these people are masukin. You just have to know that al pidin, we have reason to be choishish, and therefore you go weiter. We've had cases in the neighborhood. We have cases in Chadorim in the neighborhood. There's one case where it still wasn't in style for the Chadorim to take things seriously. There was a Kita Aleph Rebbe, and the kids in Kita Bet started speaking, and they all said that Mamash come out of the whole class that they were touched improperly. I went to the Cheder, and I told them now, you have a choice. You either report this Rebbe, or I'm going to report this Rebbe. And if I report it, then you're going to go to jail for not reporting it. So he got in touch with Shlom Banayich. They evaluated the Rebbe. Their maskana was inconclusive. So I sent him to a therapist, and his maskana was, he's not your standard case. He's such a good Kita Aleph Rebbe, he has the emotional maturity of a Kita Aleph kid. He is dangerous because he doesn't know what's proper and what's improper. But he should have nothing to do with chinuch. Baruch Hashem, he got a job as a mashkiach and a shlachtos. That was the end of it. That was the end of it. So, no playing games. But you have to know if it's emes or not. You have to know if it's emes or not. Not everybody that comes with a complaint, is it emes? Yes, there are things that are imagined. I'm not talking a little kids, got to figure out what really happened. But even with an adult, you mamish have to figure out, are they telling the truth or not? Or again, this woman definitely experienced it. But now you want to go and condemn him, you got to know if it's emes or not. Bichlal, you have to be sensitive to pick things up in voices. I know it's so much different when you talk to a human being in person. Even then, you have to be sensitive enough to pick things up. But even on the phone, you have to get used to it, and you have to see, sure, is there more to the story? And the person is always part of the story. And we all know the person is often part of the shaila. Not every shaila is a straightforward tepel-epel shaila, You have to know. So I hope this was helpful. Are there any specific questions that people want to know, what you have, are you? Listen, you're not their therapist. If the therapist says you shouldn't be answering them, then stop answering them. But if they're not getting help and you just don't answer them, they'll go to someone else. You're accomplishing nothing. And who knows what someone else is going to tell them? You may take them seriously.
So what if you have it is to tell over to people stories of certain people that have faced that may be important for this person?
Stories of other people without names. If he wants to give names, then if he wants to give names, he has to have rishus. But to give things without names.
In the professional field, if you say something, it's whatever.
Unless you have written permission. If you have written permission. It's posh. I mean, Gili Soid, Lashon Hara, isn't it poshit? Even if there's a heter of Toyeles, no one is going to come ask you shilas anymore if they find out that you tell. The loisamad and all the people that are not going to ask shilas anymore, and who knows how much help they're going to need. It's for the same reason. Why is it they're professional? If there's a loisamad, how can a professional lose his job, isn't it? The terrorist is if he loses his job, there are plenty of other people that are going to be in trouble. Sure. Otherwise, you have to be moist and nefesh, lose your job. But then there won't be, who's going to go to a therapist? Bichlal, you have to be very careful. Breaking confidentiality is a terrible thing. You know, when a person relied on you, when you break that, he's going to lose trust in everybody, especially Rabbanan. It's a terrible thing to do to a person. Even L'tei Ellis, you really have to think it over 100 times. What's this? What? Oh, his number. I don't have it with me. I don't have it with me. I have it at home. I didn't think of it. Same as Elchanan Grossboim. Elchanan, yeah, Nani. Is Elchanan Grossboim? Yeah. Anyone have his number? And if you leave a message, you tell him that you're a Rav calling with a Shaila, because he gets calls mamish from morning to night, and he doesn't get to answer all of them. For Rabbanim will answer. Okay. No. There we should help. Yeah, like everything else, Shloini Kosher B'Dvar Halacha, and certainly where it's Nageya, I mean, there are things that are Nageya with Foshes. Shouldn't Chalila make mistakes.
Thank you, Rav Berkowitz. I just want to introduce myself. My name is Shlomo Katz. I'm the director of Relief here in Eretz Yisrael. Relief is an organization which has existed in America for the last 20 years, where we take the time to meet and research clinicians, psychiatrists, psychologists, therapists, professionals, and make referrals when the need arises. Through our intake process, we match people up with the appropriate clinician for their situation based on our database of, here in Eretz Yisrael, over 1,000 clinicians. Most of them we've met. We meet good, we meet bad, we want to know everybody. This way we can really know who we're dealing with. If somebody's seeing somebody who we believe to be dangerous for them, we try and get them to see somebody different, or move them along so that they can be getting the proper help. We ask Dr. Freeman if he could please make his presentation and answer a few questions. Thank you.
I think that people don't realize how often relief saves lives. I've actually experienced this personally. This morning, my wife asked me, do you want to do the laundry or the dishes? And I said, I got to talk with Relief. So I have actually experienced this in my own professional life and can tell you it's a heck of an organization. Why are we here? Well, you're here because Kav Halacha sounds like you're frankly saving very many people from doing all sorts of terrible things without the eitzah that they need to be successful Jews. I'm personally here because I go around speaking on behalf of mental health organizations, including Relief. This started about 5 years ago when I got a phone call at about 2 in the morning from a yeshiva that had just experienced a terrible tragedy. Unfortunately, what had happened was that there was a bocher who jumped off of the dorms. This fellow jumped off of the dorms and he landed on the ground, and there were about 300 fellow students, Rabbanim, neighbors, Hatzalah, and Mada folk around trying to resuscitate him, and unfortunately they were unsuccessful. I came in the morning and I spoke with the staff, And I found out what had happened, and I gave a talk to the fellow students and to the staff, and essentially tried to give them the support that they would need to deal with this tragedy, but also to figure out how we could prevent a future tragedy. And what was so shocking about this situation was that this was a fellow who had clearly been sick for weeks. This was a fellow who had a known history of mental illness. This was a fellow who had been screaming at the Aron Kodesh at 2 in the morning, all of Sefer Tehillim. This was a fellow who wasn't eating, who wasn't sleeping, who was talking fast, who was hearing voices. And in the end, this was a fellow not who tried to jump off the roof in order to end his life, but rather because he thought he could fly. And Nebuch, this poor fellow, did not fly. He crashed, and it was witnessed by hundreds of people. So after this event, I was brought around by a number of staff members at this yeshiva to sit with their colleagues and with other yeshivas and other kollalim, and to talk with the Anhala at many different places in our community about mental health. I was brought around to speak about signs and symptoms of mental illness, to talk about risk factors, to talk about what is good help, to talk about how we can connect people with the support that will prevent this and other tragedies from happening again. And there were some places that I went to that were very, very happy to speak with me. One of these places that I went to, the Rosh Yeshiva told me, you could make a case that right now our system is so hard on the boys that every single bacher would benefit from therapy. And I'd be willing to make that case, the Rosh Yeshiva told me. Certainly with my boys. We won't reveal who that fellow was, although he's doing fantastic work. And we went to another place, and I was brought in by a friend of mine who introduced me to the Rosh Yeshiva, and I walked through the Beis Midrash, and I saw hundreds of Bacharim steiging, good Bacharim. And I went up to speak with the Rosh Yeshiva, and I introduced myself, and he said, Dr. Friedman, you learn with Professor Yaakovson, right? And I said, I learn with Professor Yaakovson. He said, that's an amazing yid. That's a great doctor. That's a big Talmid Chacham. That's a tremendous person. Yasher Koach. You should have a lot of Hatzlacha with all of your learning and your work. And I said, thank you, Rav. And he said, now, again, I'm busy today, so I'll wish you a good day. And I said, well, I didn't come for a bracha. He said, oh, what did you come for then? I said, I came to talk about mental health because this is something that happens in the community, and it's something that happens to Bacharim. And he said, Baruch Hashem, we don't have that kind of yeshiva. Baruch Hashem, our Bacharim are great. Baruch Hashem, we show up for davening. Baruch Hashem, we don't do bad stuff. Baruch Hashem, we don't drink, we don't smoke, we don't go downtown. We don't do those kinds of things at my yeshiva. And so thank you again, Hatzlacha, in all of your learning and your hard work, but I'm busy now. And I looked around the Beis Midrash and I recognized 6 of my patients. And I said to the Rav, you might not have a bad yeshiva, but unfortunately, mental health issues happen to good Bacharim too. So if you don't want to talk about this, I'm not going to waste the Rav's time. But I can tell you that some of your good Bacharim need help too. And so I started going around and having these conversations, and I linked up with great organizations like Relief. Again, Relief Israel will get about 100 phone calls a month to connect people in the community with the mental health resources that they need. Throughout the world, we're talking about 10,000 new cases in a year. Over 20 years, that's a lot of people that need help. So with that in mind, let's ask a few questions just to get ourselves a better understanding of mental health. What is mental illness? That is a great question. It's quite a mystery. Sometimes when people ask me, what do you do for a living, and I tell them I'm a psychiatrist, they look at me like I told them that I throw rocks at Merkulis. It's quite an nobody liked that joke, okay. I won't make the joke about Peor then later. What is, people like that joke, okay. So what is mental illness? Mental illness is a brain disease. In general, we think about neurological illnesses. Neurological illnesses are in the brain, and they cause problems with movement and sensation, whereas psychiatric illnesses are in the brain, and they cause problems with behavior. So essentially, we're talking about the overlap between psychology and neurology when we're talking about mental illness. And how do we diagnose this? Well, we talk about the 2 Ds. The 2 Ds are deviance and dysfunction. So with everything, there's a spectrum of what's normal. And on one side, you have these folks, and on the other side, you have these folks. And as you get further to one side or the other, that's called deviance. I'll give you an example. I'm a relatively tall fellow in that I'm bending over to talk on this stender, and that's okay. However, my brother-in-law is about 6'8". That fellow is very, very tall. He's actually coming to visit, B'ezras Hashem, with my sister, and he's going to be flying in first class. And not because he's such a hush of a guy, but rather because he actually can't fit in a regular seat. He's just too tall. So that's a fellow who's deviant. He's on one end, but it's also becoming dysfunctional, right? It causes problems for him in his life. He can't sit on a plane like the rest of us. He has to sit in first class and pay way too much money for bad food. Now, on the other end, we have folks that are quite short, and that's okay too. We have folks who are about 5'9". Is that too short? Not particularly. Is 5'7" too short? No. Is 4'9" too short? The answer is yes. And there's a guy in my community whose name is Yoyada, and he's actually 4'9". And the first time that I saw him pushing a stroller, I actually ran to go help him, and he looked at me and said, "Nu, what do you want from me? I'm an adult." And I thought to myself, I felt bad for this fellow because he actually couldn't push the stroller up the steps. And I told him, "I don't want to embarrass you, but if you need some help, I'm happy to help. I know what it's like to be a father, and fathers always need help." So he agreed to it, and I helped him schlep the stroller up the steps. And then I quietly said to myself, Mashane Abrius, because he's actually 4'9", and his name's Yoyada. So I said a Shechianu on that, because that was the first time I'd heard that one. So we have deviance and we have dysfunction. Now, sometimes it's easy to tell deviance and dysfunction, right? We have folks who are very happy, and we have folks who are kind of sad, and that's just their temperament. And then we have folks who are so sad that they can't really get out of bed on time. And we have folks who are so sad that they don't really feel like moving. They feel schwach all the time. They don't want to eat healthy. They don't want to do anything. They can't focus on their work. They're crying. They're not getting out of bed. And this is now causing dysfunction because they're getting to koilel late. And the Rosh Koilel is saying, "Nu, where were you? The Seder already started," and they're not getting there on time, and now they're getting phone calls about where are you, and now they're going to lose their tlush, and this is causing them all sorts of problems. Problems at home too. Their wife is saying, "Why aren't you helping? Why can't you get out of bed? Why can't you bring home a parnasa? Is kollel not important to you anymore?" This is causing problems. It's a deviance in terms of this is a sad person on one end, and now they're knocking at the door of dysfunction, and it's getting worse and worse. Not all people with depression have to be suicidal. Some are, but that's a case of extreme deviance. On the other side, again, some people are quite happy. Some people are always feeling good. They might identify as breast lovers, and there's no problem with that as long as their wife is okay with it. But if they're getting into all sorts of problems from being too much besimcha all the zman, and they're going to Kever Rebbe Shimon in the middle of the night and missing work the next day, and they're talking fast and moving fast and giving away all of their money to tzedakah, it's starting to cause problems. It's deviant and it's becoming dysfunctional. So the 2 Ds are what we think about when we think about a diagnosis. Yes, of course, there's specific criteria and specific textbooks, but as Rabbanim, you want to be thinking about the 2 Ds. Is this something that sounds a bit strange to me? Is this something that makes me think, whoa, there's a red flag? The 15th call that day about going to the mikveh, that's a red flag. Is it causing dysfunction? Now the woman can't go to the mikveh and she's saying, well, I wasn't ready that day and I missed the zman and then they closed. And then tomorrow I think I have to go ahead and get a new hairdo and I have to go ahead and cut my toenails. This is causing problems. It's deviant and it's dysfunctional. Rav Berkowitz said something very interesting. He said, you don't make decisions without a professional being involved. And I, as a psychiatrist, I do not make decisions unless I have a Rebbe involved. The emes is, unless I know about what's normal in your community, in my patient's community, then I have no way of telling if I'm making the right decision or not by saying this is a problematic behavior. If I have a patient, a woman comes into my office, the husband says she has OCD, she's very, very difficult about basar v'chalav, she's constantly scrubbing down everything in the house, including the children after we have meat in the family. And then he says, and now she's shaving her head. That might be normal if we're talking about people who live 6 blocks over. But if we're talking about a family in the 5 towns where all of a sudden the wife needs to shave her head, that's a bit excessive. So I need to know what's normal in your community. And you need to tell me what's normal in your community. Just as the Rav said, he had a tremendous connection with Dr. Banchak Zatzal, who was a very, very great clinician and a special man. It's so important for us as a community of professionals to have connections with you. And when we don't work as a team, we don't accomplish anything, because oftentimes our patients will find the opinion that they like between the two of us, as opposed to realizing that we're all on the same team trying to help them to be more effective individuals. How does somebody develop mental illness? Does it just happen like this? Of course not. Nothing happens like this except a stroke. If all of a sudden somebody has mental illness like this, they need to get to the hospital immediately to make sure that they didn't have an acute neurological problem, a seizure or a stroke. They need to make sure they have a urine toxicity screen to see if they're doing drugs, unfortunately. How does mental health problems develop in an individual? We'd like to call it the 2-hit hypothesis. What this means is that there's a genetic predisposition. So not just a family history, because it doesn't always show up as a family history, and frankly, we're not always good about knowing the family history due to problems with the stigma of mental health. Also, people who are concerned about lashon hara, and then sometimes people who grew up in different places. We're not always sure about the family history, but there is a genetic predisposition, and then there's the environmental stress. And essentially what happens is that a person who has an underlying risk factor for developing a problem then experiences something in their life that activates that genetic predisposition and pushes them over the edge. I'll give you an example with something we've all seen. Unfortunately, in our community, many people smoke cigarettes. And many people smoke cigarettes packs and packs a day. Now, not all of those people develop lung cancer. There are other people who smoke a few cigarettes here and there over the course of a couple of years, and then 20 years later, they develop lung cancer. Why is it that some people escape what seems scot-free, and other people have tremendous problems and develop machla after smoking for only a bit when they were younger? The answer is that some people have a genetic predisposition. Now, because we don't know what the genetic predisposition is, essentially we tell everybody, try and avoid the stressful things that cause mental health problems. So what causes mental health problems? What are the kind of stressors we're talking about? Certainly trauma, and that's a terrible thing, which is why it's very, very important that the Rav pointed out how important it is to deal with perpetrators in our community. Another thing is substance use. Substance use and alcohol abuse are things that happen, l'tzarenu, even in our community. The truth is, you have no idea how many Hasidic bochurim come into my office that smoke marijuana every single day. You have no idea how many good Erlich Yidden are using psychedelic drugs like mushrooms and acid. It is unbelievable. The amount of alcoholism in our community is striking. And this isn't just what I see, this is what I hear from Rabbanim in the community who come and tell me, Dr. Friedman, are you aware of the problem of alcohol in our community? Dr. Friedman, are you aware how many Bachurim are smoking marijuana at my yeshiva? Again, not just at the bad yeshivas. So the question is, who is at risk for mental illness? Now, I was zoche one time about 2 years ago, because it was pre-corona, to go and see the Admor a few roads down. And I was invited to see the Admor, and it turned out that it was Erev Pesach, and I was very, very grateful because I was saved from cleaning my house. And I took my sons, and I threw them in the car, and we drove as fast as we could, and we turned off our cell phones so we wouldn't get any calls on the way, encouraging us to come back and do our work. And we escaped down to Bar Ilan, and we got out of the car, and we went in to go see the Admor, and there was pushing and shoving, but we had an appointment, and we got in to see the Admor, myself and my sons. And when we got in, the Admor gave us a bracha. He gave my sons a bracha. He gave me a bracha. And I told the Admor, Kavod Haruv Shlita, I'm honored to help. B'diavad, if I can be helpful, Has v'shalom, I'd be happy to help. And he said, Dr. Friedman, I remember when it was b'diavad, but now it's la'achila. Every single person has a problem somewhere in their family. And that's the truth, because 1 in 3 people is a good number. 1 in 3 people at some point in their life will have the kind of stress from substance use and mental health problems that they would benefit from talking with a professional. Now, that doesn't mean that 1 in 3 people has schizophrenia, has bipolar disorder, has OCD, has major depressive disorder, has marijuana addiction, alcoholism. What that means is that at some point in their life, 1 in 3 people would benefit from talking with a professional. And I always tell folks that means that if you look to your left and you look to your right and you look at yourself really good, that you probably know somebody who's needed help. Now, with this in mind, the question is, who will provide that help? Who treats mental illness? And I'd like to say that we all know if you have a heart problem, chas v'sholom, you go to see a cardiologist. If you have a stomach problem, chas v'chalila, you go to see a gastroenterologist. If there's a problem with the lungs, it's a pulmonologist. If there's a problem with the joints, it's a rheumatologist. If there's a problem with the ears and the throat, it's an otolaryngologist. And if there's a problem with mental health, you go to see an acupuncturist or a reflexologist, or some weird lady that does homeopathy, whatever that is. And it's kind of ridiculous, but that's what people do. People go to all sorts of weird things and get chickens broken over their stomach and all sorts of cool kameyas from people that shouldn't be writing kameyas to deal with mental health issues, when there are great from professionals here in Yerushalayim Dafka, but all throughout the world. The world's expert in OCD is a from guy who's in New York. The world's expert in borderline personality disorder is a from guy who's here in Yerushalayim. There is no shortage of good from professionals. And as the Rav said before, Rav Berkowitz said, it's so important to see a licensed professional. Why is it important to see a licensed professional? Because they are bound by a code of ethics and a professional interaction with their patients. Somebody who knows a lot, an askan who has tons of experience, might have a pharmacy full of medicine in the back of their car, but they don't really know what they're doing, and frankly, it's dangerous. It is so important to go to a frum professional, somebody who has training in dealing with these issues. Just as I would never think of asking the shailas that you are asked, it's so important for a licensed professional to be involved in the care of a psychiatric patient. And yes, there's stigma, but that's your job as the Rabbanim who will make the referral to encourage them that Lots of people in the community have these challenges. It's so important to get the help that you need. If you get the help that you need in a timely fashion, you will get better. And keep in mind, timely fashion, that very important phrase that I said. And the reason is because if I'm going to the Grand Canyon, and I decide that I'm at the edge of the Grand Canyon, and I want to walk out from the parking lot 15 minutes right to that place where everybody's taking pictures, I will find some Japanese tourists to take a picture of me and my family at the end of the Grand Canyon, and then I'll walk back, and it'll take me 15 minutes to get back to my car in the parking lot. But if I decide to hike down into the Grand Canyon, and I decide that I'm going not just for the picture on the edge, but to go and hike deep into the Grand Canyon, and I hike down for an hour or two, how long will it take me to get back up? Not just 1 hour or two, but even more, because it's an uphill battle. And the longer that a person waits from the time when they need help until they start getting the treatment that they need, the longer it takes. And that's not just for that individual until they're feeling better and their depression, their anxiety is treated, but it's also for their family, for their wife, for their husband, for their children, for their chavrisa, for their neighbors, for their parents. It's so important to think about that when an individual gets the help they need, it's not just for them, it's for their family and their community, especially when we're talking about very, very hush of people in our community that also need help from time to time. So then, what will people receive as treatment when they come in and they need help for mental illness? Well, I tell my patients, 100% of you will get a recommendation for exercise. Cardiovascular exercise is very, very important. It is preventative of depression and anxiety. It gets our sleep schedule and our metabolism moving in the right direction. Healthy diet is something I will encourage every single person who comes in. Sobriety, not drinking and not smoking, is something that I will encourage of every single person who comes in. About 3/4 of people who come in will get recommendations for therapy. Therapy is not for everyone, but therapy is certainly for many people. And therapy is about learning skills to alleviate the symptoms and to move forward with one's daily structure. And some people will receive prescriptions for medications. But again, everyone has to live a healthy life. Most people will benefit from therapy, and some people will benefit from medications. So what again is therapy? Therapy is not cigars and couches and dreams. Therapy is about learning skills to deal with specific symptoms. And that's where it's so important to have a licensed professional who knows what they're doing, a psychologist, a social worker, a psychiatrist, somebody who knows the up-to-date research on the most effective therapies, whether it's cognitive behavioral therapy, dialectical behavioral therapy, but specifically a therapy that targets the symptoms that that specific individual is dealing with. What about medications? Well, I think that just as much as there's people who are concerned about taking medications and the stigma associated with taking medications, and people who are concerned that medications don't really help anyways. I knew people who have taken medications, they didn't get any better. I know someone who took medicine and he ended up in a psych ward. I know somebody who left a psych ward on medication and he was never the same. For everyone who's concerned about medications and them not helping, there are also people who are concerned about medications solving everything. Because the truth is, we have to have realistic expectations about what medications can and cannot do. I'll give you a good quote. Medications can help some people some of the time with some of their problems. Okay, once again, medications can help some people some of the time with some of their problems. Because medications in psychiatric illness are not like antibiotics for your child's ear infection that wipe it out and it's gone. Medications decrease the intensity and the frequency of symptoms and allow a person to get back to a healthy life and to doing the things that make them healthy. Medications are about decreasing the intensity of symptoms to allow a person to work with their therapists to move forward. Medications are not curative in most situations in mental health. They're rather about giving a person the strength to overcome a specific tekufa in order to return to the happy and healthy life that they were living that allows them to be a productive family member and individual within their community. Again, medications, we have to have realistic expectations. So I'll ask a question. What's a psychiatric emergency? Reb Berkowitz spoke about suicide. That's certainly a psychiatric emergency. I have a friend who's a top lawyer, and he always makes a joke. He says, when is a good time to call a lawyer? The answer is as soon as you get an idea to call a lawyer, you should probably have called a lawyer. So as soon as they start saying for the Americans here, you have the right to remain silent, anything you say can and will be used against you, you have the right to an attorney, you better have your attorney ready by the time they say you got a right to have him there. It is so important, similarly in mental health, the moment when you think that there is a problem with a mental health issue, with a loved one, with someone in your community, with somebody who's asking you a shaila, you better be in touch with a professional in order to better understand the situation. If there is an emergency, we are talking about potentially disastrous things, not just suicide, homicide, violence, arrests, hospitalization, but ongoing problems that can ruin people's lives without those disastrous things. What percentage of cases that come to the Bayis Din for divorce have to do with untreated mental health issues? I can't give you an exact number, but I've been told by a prominent dayan that it's more than half of cases that come to his Bayis Din, there's untreated mental health problems in at least one of the individuals. That means, in order to get to that dayan, to talk about divorce, that there have been other rabbanim involved, and those other rabbanim had the opportunity to make that referral to get help. It is so important. At that moment when you think there might be a mental health challenge, you need to involve a professional. So what do you do if there's an emergency? What do we do if there's an emergency? Well, you call MADA, you call Itzala, you call the police, you get that person to the emergency room as fast as possible. And the question is why? Why the emergency room? Well, you can always leave the emergency room once you got there. If it wasn't really an emergency, and if it wasn't really a problem, and if it's something that we can work out the next day, we can always walk out. Why do we have to stay there? The truth is, if you voluntarily go there and you're not brought in shackled by the police, you can always exit the emergency room. But has v'shalom, if something bad happens and the police are called, or if somebody does something dangerous to themselves or to somebody else, you're going to wish that you had called emergency services to get that person to a safe place as fast as possible. Here's the question. What is the best resource that you have when you need to talk to a mental health professional as fast as possible? And I would say it's the mental health professional that each of you have worked hard to develop a relationship with. Just as I advise the medical students that I supervise, the social workers and the psychologists that I teach, to develop a relationship with a posek to ensure that what you're doing is in accordance with halacha and to get the chizuk that you need to continue doing this hard work. I encourage every single Rav that I meet with, develop a relationship with a mental health professional, with somebody that you can turn and ask shilas to, with somebody that's going to be available to teach you and to help you understand the sugya. If you don't have that person, Baruch Hashem, there's a lot of great mental health professionals in this city. There are plenty of people that would love to build a relationship with each of you. It will help them to develop as a yid. It will help you to develop as a posek and a community leader. And then there's always Relief. Relief is an organization, again, that's been around for 20 years. Reb Shlomo Katz gets 100 phone calls a month. The organization gets 10,000 phone calls a year. This is what they do. It is anonymous, so you don't have to be embarrassed calling, neither does anybody that you refer to them. This will save lives. So with that, I want to make sure that we leave some time for questions. And Groiser Yasher Koach to Kav Halacha for putting this together, as well as Relief Israel. Toif, we have to have some questions. I literally explained everything in 40 minutes.
Somebody has a connection with a therapist. Is that one therapist enough for everything?
So a good therapist, just like a good Rav, will know their limits. So similar to a Rav who will tell you, I'm happy to paskin these shilas, but that's a shaila for a gadol. Or I'm happy to talk with you about Taras Mishpacha and about Bishul and about Shabbos, but about Gittin and Kedushin, that's not my specialty. So a good professional will know their limitations and will either be able to call a senior colleague to ask questions, or will be able to guide you to that colleague themselves.
What do you tell Rabbanim to do when they're under pressure?
I tell people in the same advice that I was given. So the question is, what do we do when Rabbanim feel under pressure? And the advice that I was given as a psychiatrist during my training was never worry alone. What does never worry alone mean? Never worry alone means that when a tough case would come into the emergency room in the middle of the night, I always called my friend Zevi. And I would call up Zevi and I would say, Zevi, this is a tough case. I don't really know what to do with this person. If I should send them home, send them back to their group home, if I should send them to the hospital, if I should require them to go to the hospital and be admitted there for a medical workup. It's so important to have a colleague that you speak with. So I tell Rebbes who are under pressure, never worry alone. Have a colleague that you speak with. Again, whether that's a more senior Rav that you turn to for supervision and adracha, or whether that's a mental health professional that you reach out to. What other questions do we have? So if I understand the question correctly, it's, let's say that a Rav is approached by somebody in their community who clearly needs psychiatric help and is unwilling to go. What can the Rav do? So I think this is why Baruch Hashem, there is the koach of a Rav. So we know that if a posek is asked a question and the posek gives a pesak, that this is binding in halacha. And I think that there are some people who don't want to hear that, but it's very important to tell them that this is your pasak. Your pasak is to go and talk to a mental health professional. I also will encourage poskim to, once again, build a relationship on a personal level with mental health professionals. I very frequently have new patients come into my office with their Rebbe, whether it's the Rebbe at the yeshiva that comes in with them, whether it's the Rebbe in the community that comes in with them. I think actually showing a patient, showing somebody in your community how important it is, the best way to do that is with your time. So while it can be a schlep, actually physically bringing somebody to the appointment, there's nothing that speaks louder than actions. So it's one thing to go ahead and tell somebody to do something. It's another to actually show up and go do it with them. So I do this in my own work. There are some times where I tell my patients, you got to take this medicine. And they'll say, well, yeah, I guess maybe I'll think about it. I say, it's so important to me, I'm actually going to walk with you to the pharmacy. And I will walk with you to the pharmacy. I will wait outside of the pharmacy. And when you, just to make sure that you actually got it. I'll call a patient a cab to make sure that they get to the pharmacy. I think that our actions, again, speak so much louder than our words, and if a patient is really resisting going to treatment, if you can actually bring them there, if you can tell them, oh, we're sending you to Dr. Smith. Dr. Smith is somebody who I know personally. I've seen a lot of Halacha over the years working with Dr. Smith. I know that he's seen many other people in our community. When it comes in a personal way, as opposed to saying, just go ahead and get help, then people are much more willing to listen. Other questions? That's a great question. So again, just as Rav Berkowitz said, it's so important for Rabbanim to work with mental health professionals. It's also so important for mental health professionals to work with Rabbanim. So again, I mentioned that I had a patient who was obsessing over his wife needing to cut her hair. So I have a patient who tells me, my wife doesn't shave her head before the mikveh, she's a shegitz, why are we even married anymore? And it's associated with many other things. I need to call his Rav and ask his Rav, is this a normal thing in your community, or is he being machmir in an inappropriate fashion? So when we put our heads together and think about what's deviant in the community, and then what's dysfunctional, where it's actually causing problems in the individual's life, that helps to figure that part out. Now, as far as the Yetzer Hara, this is again a tough one. I have developed also relationships with a number of people that accept all sorts of individuals. So there are folks in our community that are identified as Mekubalim, and any good Mekubal will tell a psychotic patient that they are not Mashiach. So I would say that it's important for people in our community to also be connected with Gedolei Ador, because sometimes, unfortunately, patients will only accept hadracha from Rav Chaim or Rav Hillel or somebody on a similar level. But the truth is that any gadol can spot psychosis or bipolar disorder a mile and a half away. There's a very famous story that my chavrusa used to always tell over about a time when he was by Rav Shach Zatzal. And there was a fellow who was running around in the waiting room trying to get in to talk to Rav Shach, and he looked over at him and thought maybe he could save Rav Shach some time, because this fellow looked very disorganized and was yelling all sorts of interesting things. And he asked him, knew what's going on, and the fellow said, well, there's this guy in Brooklyn who says that he's Mashiach, and I know that I'm Mashiach, and there can only be one Mashiach, so I need Rav Shach to give a pesach on who's the real one. Rav Shach opened the door, and this fellow jumped in front of the line, and my chavrusa heard, don't worry, that guy is Mashiach ben Yosef, you're Mashiach ben David, it's okay. So sometimes Gedolei Yisrael have a way of dealing with it. Again, famous story of the Boston Rebbe Zatzal, that at 4 in the morning there was a fellow banging on the door saying, I got to get in, I got to tell the Rav that I'm Mashiach, I got to get in, I got to get in. The Rebbitzin opened the door and said, what's the big deal? And he said, I'm Mashiach, it's 4 in the morning, I got to tell the Rebbe right now. She said, you're the 4th Mashiach here tonight, so I can wait until Shacharis. So again, sometimes having a relationship with those individuals that can quiet the Yetzer Hara next down can be helpful as well. I'm not sure if that answered the question, but it didn't. Okay, how do we tell the difference between the Yetzer Hara? I would say that over the course of my career, because I'm bald, I've seen probably about 14,000 patients, and that includes seeing about 5,000 Bachurim here in Yerushalayim. And at some point, it becomes easy to differentiate between the Yetzer Hara and a symptom, because symptoms go along with other things. So most of the time, a person isn't just shotei ledavar achad. There's a whole system that's set up in their life of dysfunction. The other thing that we can do is we can go ahead and ask them to think about their chavrusa, or the person who sits next to them, and ask, does the person who sits next to you have the same kind of problems in the Beis Midrash? Does the person who sits across from you, your chavrisa, have the same kind of challenges that you do? And by asking the person to compare themselves with other similar people, it gives them a window into their dysfunction and their deviance. Does that understand? Good. I just wanted to tell a few good stories. I mean, we're here anyways. Okay. Other questions? Okay. Once again, tremendous zechus to be here. Thank you so much for saving me from laundry and dishes. And we should merit to have more calls to Kav Halacha as opposed to relief. But in the meantime, it's good that relief is here.